Good morning, everyone. And I'm going to start with my usual update of where we are provincially and locally. I'm just going to make sure that this time, Jenna, just making sure, keep me posted if the slides don't change. You're seeing my initial slide, Jenna. I just want to confirm.
Yes, we do. We see your initial PowerPoint.
Okay, thank you very much. I'll just keep it in that mode so I won't have a problem. So, as you know, we've been reporting cases now differently. We're no longer looking at active cases because it's not a good indication of our real story, but we're looking more at trends, and we have other sort of what I call proxy or related indicators that are helping us. And so you can see the hospitalizations. We're still 48 with 13 in the ICU. That's across all of our 4 hospitals, including individuals in Ottawa as well. Our outbreaks are going down. They were more than 35 last week, so they're slowly starting to go down, and our case positivity is starting to go down as well. I'm just going to now show you our hospitalizations, and this is kind of where we kind of had a peak here. You saw we kind of went down here, and then we just went up a bit, but sort of overall trends are downward. So I'm hoping that that's going to continue moving forward. If you look at the provincial data, we are seeing now a downturn in not only ICU admissions that are going down. You can see slightly going down now. They're close to 500 now. They were up to 600 and something a couple of weeks ago. And so you can see now that the numbers are going down for individuals as well being hospitalized. In terms of our positivity, you can also see this is our rolling average taken from sort of the beginning of of May of last year of 2020 actually, and you can see sort of we're ups and downs, and we kind of peaked, as we know, we had a very high peak, and this is specific to the East Ontario Health Unit area, and now we're going down. We're below the 20%. We were at 30% average before, and that's gone down. Although, like I said, it's still pretty high, but you could see a downward trend. If we look at the FSAs, the areas that we had, this is a couple of weeks ago, a trend is downwards with the exception of here, the Hawkesbury area is still hovering around the 30% mark, but you can see in the other areas, it is down. If you compare it, it's going down slowly. We're still among the highest in Ontario. And if you look at the positivity rates across the province, you can also see that those rates are going down, whether it's workplace screening, repeat testers, or hospital admissions. Because as you know, all hospitalizations are tested regardless of if they're in for COVID or not. You can also see that positivity trends are now trying to go down, and you can see we're one of those health units that are going down. So overall, there are a trend downwards. The other thing that we look at is wastewater in our wastewater plants, and you can see again, we now measure Cornwall, Hawkesbury, and Castleman. You can see that there was in Cornwall, there was a big peak that corresponded with our cases, and then it kind of went down, so it's going a downward trend. Hawkesbury, we're seeing again still a bit of an uptick here, and it's not a coincidence that Hawkesbury still has among our highest positivity in our area, and then you can see Castleman has kind of peaked and is on its way down. So, and then if you look at this provincially, you can actually see the same, that the wastewater numbers are going down, and so that's a good sign. And usually with the older version, with the Delta Alpha versions, the wastewater always lag the week or so, but the Omicron transmits so quickly that it's almost real time. So it really correlates with the number of cases that we have. So it is a good measure for us as we move forward. Going now to vaccinations. We're basically now continuing our vaccination campaign. We're almost at 56% third dose to our population who's 18 plus. We're almost at 88% 5+ population, first dose, and 82% second dose. And so we're continuing with that. More specifically, in terms of our age groups, you can see that we're progressively increasing, particularly among the elderly. We're still got some ways to go in terms of bringing them up to the higher levels that they were, particularly the 50 and above age range. But again, we're progressing week by week. And so you can see that the younger populations are obviously lagging. And in particular here, you could see obviously the 5 to 11-year-olds where we're now at 50%, and that's again almost a provincial average. With first dose, and now we're at 12.9% because we're starting to deliver a second dose to that population as well. I want to talk a bit about vaccine effectiveness. And again, there's been a lot of questions about, I got vaccinated, but I still got it. Well, yes, we understand that because we know that Omicron, with 2 doses of the vaccine, you can still get it. That's the bottom line. This is what we worried about. Omicron is what we call vaccine resistant or vaccine evasive. And so we know that. So that's why we're seeing a lot of cases. However, the picture is different when you look at hospitalized cases and you look at ICU cases. Then you could see by far that even the 2 doses still protect significantly to about an 80-85% level against Omicron-induced hospitalizations. And you could see that very clearly here, where you have the rates of hospitalizations among the unvaccinated versus the vaccinated. It's very, very clear, and you could see it very clear and visually as well. The other thing that a lot of people are telling us as well, when you look at the numbers, there's a lot of people hospitalized. There's almost as many people hospitalized as vaccinated versus non-vaccinated. Well, we created a video actually that I'm hoping the media could share. It's on our website, where we actually tried to put a visual context into the number of cases. So yes, so like in hospital right now, for example, ICU, there may be a certain equal number of vaccinated versus non-vaccinated, which is the purple here. But in the context of the majority of people here that are fully vaccinated, it's a very small percentage that ends up in the hospital, where it's a higher percentage that ends up in the hospital and ICU among the non-vaccinated. So that's something that we need to take into account when we look at those absolute numbers. That's why I don't report the numbers on a daily basis for hospitalizations, because you need to look at it over the long term. And over the long term, we see this. We see basically that the rates of hospitalization among the vaccinated versus unvaccinated is starkly different. Now, I want to talk about the 3rd dose vaccine effectiveness, because we're really not where we should be. I'd like to be much higher. I'd like to get all the individuals that have their 1st and 2nd dose to get their 3rd dose, but particularly the elderly, as you saw there, because those are the ones in terms of our deaths. We've unfortunately had an increasing number of deaths because more people have gotten infected, and again, disproportionate to seniors. And so I'd really like to see the 3rd dose numbers go up as high as possible. And as I said before, when you get a second, if you're 2-dose vaccinated, you are protected against severe disease, at a high level. But you're not really protected against getting the infection because, again, the Omicron evades the vaccine in terms of infection. However, a 3rd dose, now we have some studies, and again, these are ongoing studies, so these may change, but a 3rd dose is between 60 and 68%, some studies say 70%, effective against preventing Omicron infection. But, between 90, depending on the study and country that you look at, between 90 and 90% effective against severe hospital infection, i.e. hospitalization and so on. So it's very important that the 3rd dose is the one that gives us a higher rate of preventing the infection, albeit not as high as against Delta. But again, it gives you 68% is higher than what it is right now. It's barely 20% right now with 2 doses, but it increases significantly the already high levels of 2-dose protection against hospitalization. That's very important for us to really get the message. So I encourage everybody, if you haven't got your 1st dose, get your 1st dose. If you haven't got your 2nd dose, get your 2nd dose. And by all means, please get your 3rd dose. Our clinics now are open to everybody. We have plenty of vaccine, plenty of room. People can just walk in and get their vaccination, be it 1st, 2nd, or 3rd dose. And that's quite important. That's an important message. So moving forward, again, I can't stress the importance of vaccination. Again, 3rd dose, I think, is important because that'll increase the level of community-wide protection. And then if you combine that with people that have got infected, there's still a high level of herd immunity that will help us, go into more normalcy, which I'll talk about a bit later. Obviously, we'll continue with the high-risk priorities in terms of long-term settings and so on, hospital outbreaks, congregate settings and so on, vaccinating them as well, obviously, or we're going to monitor our indicators that I've showed you, and in particularly as we move into less restrictions. As you know, as of the 31st, as of Monday, right now restaurants and gyms can open at 50% capacity. The people that can gather has increased a bit, and if all goes well based on those indicators, by the 21st of February, there'll be even more restrictions removed, and then 3 weeks later there'll be even more restrictions removed, and so which is good. So so that still means that we need to. That depends on adhering to the masking, washing your hands, physical distancing, and so on, and getting our vaccinations as high as possible. Obviously, school reopening has occurred. We're working with our school boards on a regular basis to keep an eye on that, and obviously, I've talked about it sort of, I know that Dr. Moore has said, living with COVID. And what he means by that is, it's become kind of endemic. It's with us. It's a shift. So if you combine the number of people that have been vaccinated, plus the people that have been infected, that gives you high levels of herd immunity, community immunity that will stave off the virus. And in combination with, our continuing public health measures and so on, we will be able to live with it, without any closures or restrictions to gatherings and so on. And we also now have the antivirals that are now distributed across Ontario and available for high-risk individuals. As we get more, it'll be much more available. And that's, to me, a game changer as well, because that's going to allow us to really at once protect our vulnerable population, because they're very effective. If you take it within a couple of days of your symptoms, if you're positive for COVID, the antivirals prevent hospitalization to almost 89-90%, and so that is important. And at the same time, it's going to offset the load of the hospitals, which are now starting to revamp their non-urgent clinical activities, which have been left behind, operations, procedures, those things that have been canceled because of the COVID preoccupation. And so, to me, that's important. And then the other thing that we're looking at, we can learn from history, and I shared this with a couple of people, and I'll share this with the media and the public that are looking at this. It was called the Russian flu pandemic, and this was in 1889 to 1891. Killed about 1 million people in Russia, and there's a lot of studies now and thought going backwards and looking at what caused that. And people, I think the consensus is that it was really not the flu, the influenza. It was actually a coronavirus. It was a coronavirus pandemic, and so it's not dissimilar to what we're seeing now. And so what they saw in those points, they honed in on the virus called the human coronavirus, OC43. It's just a strain, which, by the way, right now is the cause of the common cold. And what they saw in this were, again, 1 million people died, and that was localized to the flu in those days, because there was not worldwide travel, there was not airplanes and so on. It was 1800s, so it was localized. But 1 million people is a lot of people just for Russia, because, again, the population wasn't as big as it is today 120 years ago. And so what the pattern of disease is uncanny of what the people were having there. They actually had multi-symptoms, respiratory, gastrointestinal, neurologic symptoms, including loss of taste and smell, which is what we see now with coronavirus, with the COVID-2. They also had long recovery, which is like long COVID, and then we also saw multiple thrombosis, heart attacks, strokes, and all of these things that we're seeing now. So I think that is compelling. And the other thing that is compelling is the pattern of which it infected people. It's just like COVID-19. Unlike influenza, it was mostly elderly individuals. The older you were, the higher at risk you were, and children were only weakly affected. Again, sounds like COVID-19 to me. And they also thought that at that point it came from pets, either a cow or a horse. They weren't sure, a kind of strain that mutated and then started to that. And now this particular strain actually is one of the causes of the common cold. For the coronavirus itself, we're familiar with it. Is one of the four. There's 4 species. This is one of them that causes the common cold. So I think that's where we're headed. And this is just a transition period that we have right now. And so hopefully, like I said, this will transform itself into a virus that will just infect us like the common cold or the flu yearly. Whether or not we need a vaccine, we're not sure. But again, I think this bodes well to moving forward as we try to get out of the restrictions, get out of the pandemic restrictions, particularly in our area in Canada, where we've been doing quite well, compared to other people, other countries in the world. So Jenna, I'm ready to go with questions.
Thank you, Dr. Paul. Merci. There are currently no questions in the chat box. If anyone has questions, please unmute yourself now. If you are joining by phone, press *6. S'il y a des questions, vous êtes invité à ouvrir votre microphone. Si vous vous êtes joint par téléphone, appuyez les touches étoile 6. We have one question, une question. Emmanuel Poisson, Radio-Canada. C'est à vous?
Bonjour, Dr. Paul. Merci beaucoup de prendre ma question. Si vous pourriez me répondre en français et en anglais, ce serait grandement apprécié.
Okay. Oui.
On entend de d'autres experts de la santé qu'il va y avoir un vaccin spécialement pour combattre le variant Omicron.
Mm-hmm.
Pour ceux qui n'ont pas encore eu leur 3e dose ou encore ceux qui ont eu 2 doses, mais qui ont été infectés par le variant Omicron, est-ce que vous leur suggérez d'attendre que ce nouveau vaccin-là soit disponible? Ou encore, ils devraient tout de suite aller se faire vacciner, puis après ça, on verra quel vaccin sera disponible.
Oui, bonne question. Je vais répondre en français initialement. Je pense que oui, c'est sûr et certain qu'il y a les 2 compagnies Moderna et Pfizer ont des vaccins prêts à faire tester pour l'Omicron, le variant Omicron, et ça ne me surprend pas parce que la technologie est là. Mais je pense qu'on est loin de l'avoir disponible dans la population. Donc, entre-temps, oui, quelqu'un qui a besoin de la 2e dose, ou même qui a subi, qui était infecté par Omicron, devrait se faire vacciner avec la 3e dose. Et on va voir dans l'avenir si on a besoin d'une 4e en dessus sur ça. Mais je pense pour le moment, on ne peut pas attendre parce que ça ne va pas être disponible dans les prochaines semaines. On parle des mois que ça soit disponible, mais ça va être disponible comme vous avez dit. The question really was if an individual, given that companies now have in their hands actually an Omicron vaccine, the question is, do people who need a 3rd dose or who have had Omicron infection, do they wait until that comes out? And my answer really is no, because the Omicron vaccine is not ready for market yet. It's still being tested, and it's going to be months until we have that available. So in the short term, if an individual needs a 3rd dose, I recommend to get the 3rd dose because it will give you some protection against Omicron, like I've shown, and increase your protection against the other variants as well. So it's a win-win. And if for some reason there was an Omicron available or another booster is available, we can take it from there. But it's going to be months before that would be available to us. And right now, we need our protection of 3rd dose to go up as high as possible in our population.
Parfait, merci. Ma 2e question, c'est que le BSEO a cessé de publier en fait, le nombre de cas rapportés par jour, mais également les hospitalisations, comme vous l'avez mentionné un peu plus tôt lors de la conférence de presse. Est-ce qu'on peut s'attendre à ce que ces chiffres-là soient publiés à nouveau de façon quotidienne? Et pourquoi ne pas publier les hospitalisations de manière quotidienne, comme le font d'autres bureaux de santé en Ontario, mais aussi ailleurs au pays, pour nous indiquer comment se joue la pandémie dans notre coin de l'Est de l'Ontario, et en français et en anglais, si vous plaît.
Oui, avec tout le respect, vous êtes tard. On publie à chaque jour l'hospitalisation. Parce qu'on a changé les façons qu'on fait rapport, mais comme j'ai mentionné sur mon diapo tantôt, on les publie de façon quotidienne. Avec les flambées, avec aussi le taux de pourcentage de wastewater, etc. Donc, on le publie déjà, je ne sais pas où vous ne le voyez pas.
Non, vous avez raison. Toutes mes excuses dans ce cas-là.
OK.
Mais merci beaucoup.
Pas de problème.
If there are other questions, please unmute yourself now. S'il y a d'autres questions, vous pouvez ouvrir votre microphone. There are no other questions today, Dr. Paul.
Thank you. Merci.